Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Peggy Leung, infection preventionist at PIH Health Hospital, to talk about how her team is using rule-based artificial intelligence to prevent hospital onset cases, improve patient outcomes, and drive smarter infection prevention practices. We're really excited to have you here today, Peggy.
Thank you very much. I'm very happy to be here.
So let's get started today with just a little bit about your background in infection prevention and your role at PIH.
So I have been in nursing for about 19 years. So in my last 5 years, I became an infection preventionist. So my daily work is to rely on data collection, and then also we do a lot of work to help prevent infection in the hospital. So one thing is that we do a lot of surveillance, and definitely we rely on data to help us gauge what do we need to do better and what area we need to improve on. What can we do to prevent infection in a daily basis at a healthcare facility?
How did your team begin exploring new ways to use data and technology to support infection prevention?
Because in 2023, we have increased amount of C. diff infection. So our hospital decided to use rule-based AI to help us identify patients with diarrhea early onset, so we can isolate them, test them early to prevent outbreak.
And, it sounds like C. diff is a major cause of hospital-associated infections, so early detection is critical. What are some of the challenges that your team faced in identifying and managing cases quickly enough to prevent that hospital onset infection?
So at the beginning, when we noticed that almost 80% of our C. diff infection is because of late testing, so our nurses are having a hard time to remember or identifying patients with early onset of diarrhea. The problem was that they're supposed to test patient between hospital day 1, 2, and 3, so that if the result came back positive, we can identify those patients as community onset. If you pass that timeline, then now this infection will become a hospital onset infection. So really, the challenge is sometimes nurses, they don't document consistently, and sometimes they document late, they identify late, they test patient late, so it's really becoming a problem.
Walk us through how this works in practice, the rule-based AI that's detecting C. diff earlier.
So the AI will detect this patient, all the patients, if they have early onset of diarrhea, and they convert all the data together into a report. Our IP or the nursing managers will use that report to identify those patients who might be at risk for infection. So we want to test them early. And the charge nurse of the day will contact the primary nurse and remind them, hey, your patient is having diarrhea right now, and is still within hospital day 1, 2, 3. It's really time for testing. So it really gives a prompt for our nurses and remind them to test early, isolate them early, and start treatment early if the patient came back positive with the infection.
And I'm glad you kind of mentioned this, the nursing staff. We know that AI can surface the data, but the people are really critical to turning that data into action. So tell me a little bit about how you worked with nursing and frontline staff to make these alerts meaningful in daily practice.
We actually make phone call, and then we have to talk to the charge nurse and making sure that in the report they will mention this patient have diarrhea. We need to test the patient. Sometimes they have to even call the doctors and explain about the sign and symptoms. So that really helped the early detections. A lot of time, if we don't able to, without this technology, if we are not able to identify them early or even remind our nurses early, it's really hard for them in their daily nursing routine. They have so much to do. Just a simple prompt, it's really helped them to save their time, to accurately identify those patients.
And this project has shown measurable results quarter over quarter. What outcomes have you seen since applying role-based AI to identify potential C. diff cases earlier?
Significant outcomes, I have to say. With the help of this AI project, we were able to lower the infectious rate from 1.077 to 0.722. It's a significant change, and now we're below the national benchmark of infection rates, and we're able to reduce any. We're able to detect this C. diff infection early on, and we're able to prevent outbreak. We further protect our patients from being infected. So I really think that this is a great change.
So how do you see these tools continuing to evolve in hospital settings? And is there any advice that you might share with other infection prevention teams who are looking to integrate analytics or AI into their daily workflows?
We need to make sure that this data will be able to help us sustain the outcome. I really think that hospitals should rely on our data and trust it. It's really sometimes the AI run the data, but then hospital not feeling comfortable, not relying on it is important that we utilize it and then we use it to prevent diseases.
Well, Peggy, this has been certainly an incredible project that your team has gotten off the ground, and it's been a real pleasure sitting down and talking with you today. Thank you for being here, and of course, thank you for your continued partnership with Inovalon. And to all of our viewers today, thank you for watching. Keep an eye out for our next INOvators episode coming soon.